If you're currently considering undergoing a total knee replacement and you're wondering what the process afterwards looks like, then this video is going to have the answers for you. Hi everybody, my name is Will Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today I'm going to be revealing what to expect after a total knee replacement. Now, before we dive into the content of the video, if you haven't already, please remember to hit subscribe to this channel and to like the video because it helps me to reach more people just like you. Now that that's been said, let's talk about total knee replacements. Now, total knee replacements are a really common surgery, but even though they're very common, it's also categorized as major surgery. So it's not a decision to be taken lightly. Total knee replacements are usually done because people have something called arthritis, which affects the knee to such a bad extent that they're struggling to walk and to sleep well. And it really affects their quality of life to the point where physio can't help, medications can't help, and they're pretty much stuck. So for people who have arthritis to this extent, a total knee replacement becomes the only option. Now, total knee replacements have absolutely revolutionized the way we treat advanced arthritis. I'm going to use my knee model to show you how they work. So this is the knee joint here. You've got the kneecap on top, you've got the thigh bone here, which is the femur, and you've got the tibia here, which is your shin bone. Now, a knee replacement involves opening up the front of the knee, pulling the kneecap back, and basically cutting off the bottom part of the femur and the top part of the tibia, okay? So if the knee normally bends like that, they're taking off the parts of the bone that articulate with each other. Now they'll slice a bit off here and slice a bit off here. Then what happens is the surgeon puts a prosthesis, so they put a usually aluminium, almost replica of the plateau of the tibia down there, and they put an aluminium knuckle on each side of the femur. So they replace both parts of the bones that rub together. In addition to that, the surgeon might put a prosthesis behind the kneecap as well. So they put a aluminium shaped disc behind there too. So what you'd end up with, instead of the bone rubbing against the bone, you have two aluminium parts of the joint which will articulate together much more happily than someone who has terrible arthritis. And because the kneecap moves as part of the knee joint as well, if that has been replaced, it takes away the symptoms of patellofemoral arthritis too. So that's a knee replacement. And in terms of that kind of a surgery, because it's such a major thing to undergo, the first parts of a knee replacement are often very painful. So we're going to talk about what it looks like after the surgery. We're going to talk about what's normal and what's not. And then we're going to talk about exactly what to expect all the way from surgery day one right through to feeling completely better. So let's start with what you should expect at the hospital. So once you've undergone the waiting list and you're ready to have your total knee replacement surgery, you'll head in to the doctor's office and you'll undergo a pre-surgical screen. Now, this will involve being asked questions about your health and just to make sure that everything is a-okay before you undergo surgery. You'll see your consultant. They will probably come in and draw an arrow on the knee just to make sure they operate on the right one once you're in the surgical theatre. And obviously before this has happened, you will have decided whether you want a nerve block, which is where you become numb from the waist down but you're still awake, or a general anaesthetic, which is where you're out cold and the surgery is done without you being aware of it. Now, there are pros and cons to both of these options. The pros to having just the nerve block are that you tend to feel better after the op because you don't have to recover from the general anaesthetic. But the cons are, if you are squeamish or if you are, a bit worried about what's going to happen when you're in there, it might be too uncomfortable for you to listen to the noises and to kind of feel, the fact that something's happening to you behind a screen. Luckily, if you do opt for a nerve block, you will have a screen put up so you won't see anything happening in your knee, obviously, because otherwise you'd freak out. But it tends to be better afterwards in terms of, feeling better and getting back on your feet. You also don't have to worry quite so much about passing urine and going to the toilet after the op if you've just had a nerve block. So after you've had your surgery, you'll be wheeled down. Obviously, the surgery will happen, and the surgery typically takes somewhere between 90 minutes and 2 to 3 hours, depending on the complexities of what's happening. You will be taken to recovery and the anaesthetic will start to wear off. Now at this point, you'll be given much higher doses of painkillers than you usually have at home, just because the initial stages of recovery are quite painful. So in hospital, you will usually spend somewhere between 1 and 3 days in recovery after the surgery. And the job of this recovery window is to obviously help you regain full consciousness after an anaesthetic, but it's also for physios to come in and show you how to get up and get moving. Now, after a knee replacement, 99% of people will have to use elbow crutches. So a physio will come out and they will show you how to use 2 elbow crutches to stand and to walk. They'll also check that if you have stairs at home, you can use them using the crutches. Now that's too complex for me to go into today, but if you like, I can make another video on this topic. If you want that, please leave a comment below if you'd like to learn how to use crutches on stairs. So after that's been done, you'll be given painkillers to take home, and these painkillers will hopefully tide you over your recovery process for at least the first couple of weeks. So you'll be given a compression stocking to make sure that as you're not moving as much, you don't develop a blood clot in your legs, and you'll be given some exercises to do at home for the first couple of weeks. These exercises usually involve moving the ankles up and down, keeping the hips mobile while you're sitting in a chair, and some very gentle knee range of motion exercises to get the knee moving again. So now that's happened, you're at home and you're starting the home recovery process. So for the first 2 weeks, once you're home, after day 3, so from day 3 to day 14, what we're trying to do is reduce the swelling of the knee. After a knee replacement surgery, your knee is going to feel very hot, it's going to feel very swollen, and it's going to feel painful, especially at night time. So one of the biggest things that people experience after a total knee replacement surgery is pain at night. And unfortunately, this is normal. There isn't a huge amount you can do for it apart from apply ice and take your painkillers. So in terms of getting the swelling down and reducing the pain, ice and cold are very important for total knee replacement recovery. You could put a bag of frozen peas or a bag of ice on your knee, which might help. But the best thing you can do is get hold of what we call a cryo cuff, which is a machine which has a flexible cuff that wraps around your knee and your leg. And when you turn it on, it fills that cuff with a combination of ice cold water and air to provide compression and cold at the same time. That tends to work for controlling the inflammation and the pain the best. You should be using either ice or the cryo cuff as much as possible in these early days to reduce the pain and reduce the swelling. So the other thing we would try and do in this first 2-week period after a total knee replacement is to make sure you're putting a little bit of weight through your knee when you're walking on crutches. So for the first 2 weeks, almost everyone will still be using elbow crutches, which is totally normal, and you should be on crutches. And what you would do is you would first start with non-weight bearing, so not putting any weight through the leg at all. And then you would start toe touch weight bearing, so putting a little bit of weight through the foot as you walk. Then you would go up to partial weight bearing, which is putting 40 to 60% of your weight through the foot when you walk. And you would just slowly increase that, probably not much more than 50%, 60% in the first 2 weeks. But when you start to see a physiotherapist after the 2-week point, that's when they will start to increase that weight bearing status, so you're putting more and more weight through your leg. Don't try and progress this process on your own. Wait to be told what to do by a professional. Now, the other thing we need to do in the first 2 weeks that continues right throughout the process is improve the range of motion of your knee. When someone comes out of a total knee replacement surgery, their knee is very, very stiff. So quite often people can only bend their knee sort of 60, 70 degrees afterwards, which is not enough to have normal knee function. So one of the priorities of rehab is to regain that range of motion, both to get the knee bending and to get it straightening. Now, you'll be given some exercises post-surgery to do that, but after the 2-week point, you will start to see a physio. And when you start to see that physiotherapist, they will show you how to progress those range of motion exercises to get the knee moving. Now, I can't stress enough the importance of getting the knee bending and straightening in the first few months. You have a 3-month window of opportunity to get that knee going. After that, the progressions slow down a bit. You can improve it up to about the 6-month point, but the first 3 months are absolutely key. So make sure you get as much physio as possible at this stage, and you're doing exercises that help you improve the bend and the straightening. At our clinic here, we see a lot of total knee replacement patients, and what we do every single time they come in, using an angle measurer called a goniometer, we measure how much they can bend and straighten their knee, and we look for an improvement every single time. So that's what you should look for too. So after the 2-week point, while we're still in that first month, what we'll try and do with patients who've had a total knee replacement is slowly reduce the reliance on their crutches. And by about the 4-week mark, 4 to 6 weeks, we look to reduce the 2 crutches to 1, so they're just using 1 crutch. And then from that point, we look to get them independently walking, so they're using no crutches at all. As that's happening, the other thing we try and do is normalize their gait. So when you first have a total knee replacement, unsurprisingly, you'll be limping for a while. But what we need to try and do is normalize that limp. So your physiotherapist at this point will show you how to walk with a heel to toe pattern, which will help your steps look a bit more normal, and it will reduce strain on the ankles, the knees, the hips and the back. If you aren't sure, then have a look at speaking to a physio who can help you improve your gait. They should do that as a matter of course. If you feel you're still limping after about the 8 to 12 week point, then you should get someone to have a specific look at your walking. So after the first month, you are possibly down to 1 crutch, your pain is hopefully coming down, the swelling is well controlled, and your knee is moving a bit better. So what are the goals then? Well, the main goal is to continue to improve range of motion as much as we can. Remember, we've got 3 months where this is key. And then we need to build strength. After a big surgery like this, the knee becomes a bit weaker. The muscles around the knee don't work quite so well just because it's been interfered with. So we have to regain the strength in the muscles around the knee. So this is really important. So you'll be doing lots of exercises to build strength of the thigh muscles and the hip muscles, and we'd also look at improving the flexibility of those same muscles too. After the 12-week point, you should have good range of motion. You should be walking well with no crutches. You should be independently mobile. You should have good flexibility and strength as well. And when we get to that point, we look at reintroducing the things you want to do. So it might be long walks, it might be cycling, long distances, it might be playing golf. After the 12-week point, this is where we look at introducing those things again. So the first 12 weeks are all about rehab for your knee, but after that point, the rehab should be specific to what you want to do. Now, overall, most people note that their knee is in a really good state after about 6 months post-surgery. It's very difficult to tell whether someone has had a successful knee replacement until about the 6-month point. And the reason is that some people improve very slowly to begin with, then suddenly get better, whereas others improve very quickly and then run into trouble. But overall, over that 6-month period, most people do very, very well. Now, it'll be a challenging 6 months. It's certainly not an easy recovery process, but if you stick to doing what your surgeon and your physio tells you, you should be totally fine after that point. Most people work on their knee specifically for about a year just to make sure they have the absolute maximum they can get out of their new knee joint. So I would recommend working specifically on your range of motion, your strength and your mobility for at least a year post-op. And then at that point, you should have what you would refer to as your new knee. And hopefully it's everything you hoped it would be. Now, a couple of precautions for things that people with knee replacements can't do. One of those things is most people with a knee replacement can't run, okay? So you have to be willing to accept that running might be out of the equation for good. The other thing that many people with a knee replacement can't do is kneel, okay? And this can be a problem for gardeners. One way around this is to put your opposite knee down on the floor and to have the knee that's been operated on up. Your surgeon should be able to advise you better, and depending on the way they've done your surgery, you might be able to kneel and you might not. So be prepared for that before you make the decision to go ahead. Now, I think that's just about everything I have to say about post-recovery from a knee replacement. If you have any questions about this video, please drop them below. But thank you very much for watching, and if you want to get more from me, please feel free to pick up a copy of my book, Thriving Beyond 50. You can find it on Amazon using the link below this video. Anyway, that's all I've got for you today. Thank you very much for watching, and I look forward to speaking to you on the next one.